डॉक्टर वी मोहन सर से बात करेंगे। वी मोहन सर 77th नेशनल एपिकॉन के लिए जयपुर आए हुए हैं। जयपुर शहर बहुत आभारी है इनका दैट ये जयपुर आए हैं। आज इस कॉन्फ्रेंस में डॉक्टर वी मोहन ने बात करी है रिवर्सल और रेमिशन ऑफ डायबिटीज़ में क्या डिफरेंस है। क्या हम लोगों को एक भ्रांति फैला रहे हैं, एक मिथ्या बात सिखा रहे हैं कि रिवर्सल पॉसिबल है? क्या सचमुच रिवर्सल पॉसिबल है? क्या हम रेमिशन और रिवर्सल के डिफरेंस को समझ पा रहे हैं? सर, आप ही से पूछते हैं। वील आस्क यू एंड हियर फ्रॉम यू सर दैट पीपल हैव बीन actually misguided by the media saying reversal of diabetes. So is it really possible something like reversal exists?
I think you touched on the right word to be used, and the American Diabetic Association and the international bodies have very clearly said, don't use the word reversal, use the word remission. Why? Because the word remission is used in medicine quite often. You can have a cancer, you treat the cancer, let's say a breast cancer. You treat the cancer with surgery, chemotherapy, radiotherapy, whatever, hormone therapy, you have treated the cancer. Then the lady is in remission for 1 year, 2 years, 5 years, 10 years, in my wife's case 17 years in remission. But then is it a cure? Well, technically you can use any word you want, but really it is not. The disease is quiescent. It may come back at any time, and we do not know why sometimes it comes back. There are other examples, psoriasis, rheumatoid arthritis, many diseases which will be there florid and then it goes away maybe for 4, 5 years, 10 years, then suddenly the disease can come back. In diabetes also, therefore, the American Diabetes Association has said, don't use the word reversal because it is giving a connotation that the disease is permanently gone. Any disease like type 2 diabetes, which is partly genetic and partly environmental, cannot completely go away, because when you are born itself you have those genes to get the disease, and at some point you put on weight or you had stress or something and the disease has come. The disorder has now turned into a disease. Now, if you remove some of those irritants or those stimulants of the disease, in this case it could be obesity, it can be a high carb diet, it could be eating too much, it could be not exercising, it could be stress, it could be certain medicines like steroids, it could be something. When that offending agent is removed, the diabetes may temporarily go away. When I say temporarily, usually it is for a few months, 1 or 2 years. It is not for the next 25 years you may not have diabetes. So, during that period we can use the word remission. Now, the media and a lot of people who have taken to this business, I would say, are promising everybody that their diabetes can be reversed. First of all, this is not correct. I will tell you certain things where you cannot reverse diabetes. Take type 1 diabetes. It's a type of diabetes where there is no insulin at all. There is zero insulin production. If you stop insulin, the child will die. Usually it is in children. You can't reverse that by any known method today. Maybe it will occur 5 years later. Today there is no reversal of type 1 diabetes. There are many other types of diabetes like this where you cannot reverse. Type 2 diabetes, on the other hand, is a slow kind of onset disease. There is some genetic background, but environment plays a very big role, of which obesity, physical inactivity, wrong diet, stress, all these are factors. If you attend to those factors, and especially if you remove obesity, say 10 to 15 kilograms if you are able to lose, then such people may be able to achieve remission. In another talk which I am giving at APICON today, we are going to talk about different clusters of type 2 diabetes. So, there is one type which is called a severe insulin deficient variety, where they are thin and they get it at young age. Now, that is not reversible at all. Whereas, there is another variety called as insulin resistant obese diabetic. Now, that is eminently reversible. So, what we have to do is find out who are the subgroups of people in whom this remission we can try, and then encourage them to lose weight. Of course, they have to cut down on their calories quite significantly, maybe to about 800 calories per day, which is very not sustainable in the long run. But as long as they want to do that, if they at least want to have the satisfaction that they have got rid of their diabetes for some time, then we can encourage them to go into remission. So, do not use the word cure, do not use the word reversal, use the word remission. Now, bariatric surgery is another example where you lose 30, 40, sometimes 50 kilos in weight. Now, even after bariatric surgery, not everybody achieves remission of diabetes as they claim. A significant number do, especially if you are diagnosed early, and in the early stages itself you get your bariatric surgery done. or this remission you try in the first 6 years after the diagnosis, then you can probably achieve remission. Also for thin people it is more difficult to achieve remission because their insulin deficiency is more than for obese people. So, we have to identify these people and then encourage them to try to reverse diabetes. But one other point that I would like to say is, it does not matter if you do not reverse the diabetes. For the last 50 years I have been in this field, and only now we have started talking about reversal of diabetes and remission of diabetes and so on. During these 50 years, I have had people who have lived for 60, 70 years after getting diabetes. Some of them have crossed 100 years of age. They are still taking their tablets. They have lived to tell the tale, and they have not had any complication of diabetes. They have lived a full, healthy lifespan with good quality of life, and they have not achieved remission. So, why should they achieve remission to live up to what is your ultimate aim of treatment? It is that you live a long and healthy life, that you can do even if you are taking medicines, even if you are continuing with your diabetes. One last thing I want to say is that these people who believe that if they get this so called reversal or remission of diabetes, after that they are in paradise and they can eat whatever they want, any gulab jamun, any ice cream, they do not need to exercise, they can do whatever they want. Forget it, you will not be able to do any such thing. The moment you do all that, your diabetes will come back, because it's like a tiger waiting to be let out of the cage. The moment you put the tiger in the cage, so tiger is quiet now. Release the cage and then open the cage and the tiger is out, it will come back again. So, diabetes reversal or remission, as we correctly would like to call it, is just that. It has just been tamed, it is put inside a cage, and as long as it stays in that cage, it is fine. Do not let it come out of the cage.
थैंक यू सो मच सर. मैं एक बार हिंदी में थोड़ा सारांश में बता देती हूँ सर ने क्या कहा. सर ने कहा कि जितनी भी इंटरनेशनल बॉडीज़ हैं, जैसे अमेरिकन डायबिटिक एसोसिएशन है या जितनी और हमारे इंटरनेशनल डायबिटीज़ फेडरेशंस हैं, उन सब का ये कहना है कि डायबिटीज़ रिवर्सल शब्द का प्रयोग ना करें, क्योंकि डायबिटीज़ का रिवर्सल मुमकिन नहीं है. जो उचित वर्ड है या जो शब्द का प्रयोग करना है वो है रेमिशन. जिस तरह से कैंसर को हम रेमिशन में रखते हैं, 10 साल, 15 साल, 20 साल की कैंसर का उचित इलाज करने के पश्चात वो एक क्वाइट स्टेज में चला जाता है या सटल स्टेज में चला जाता है, उसी तरह से रिवर्सल नहीं मुमकिन है. रेमिशन एक स्टेज आएगी जब आप डायबिटीज़ के हाई शुगर्स नहीं देखेंगे, जब आप डायबिटीज़ के कॉम्प्लिकेशंस या साइड इफ़ेक्ट्स नहीं देखेंगे. और वो रेमिशन कैसे मुमकिन है? आपकी लाइफस्टाइल को चेंज करने से. जैसा सर ने कहा कि एक शेर है जिसे पिंजरे में बंद करके रख दिया है, और वो पिंजरा क्या है? आपका नियमित आहार और नियमित एक्सरसाइज. तो वो जो लाइफस्टाइल है वो आपका पिंजरा है, और अगर आप उस पिंजरे के अंदर रहते हैं तो शेर बंद रहता है. तो हमें पूरी लाइफ, ऑल थ्रू योर लाइफ, डाइट और एक्सरसाइज को फॉलो करना है. दूसरा, सर ने एक बहुत इंपॉर्टेंट बात बताई कि हर डायबिटीज़ में तो ये भी मुमकिन नहीं है. कुछ ही डायबिटीज़ हैं जिसमें ये रेमिशन मुमकिन है. तो सर ने बताया कि जो टाइप 2 ओबीस पॉपुलेशन है, केवल वही पॉपुलेशन रेमिशन ट्राई कर सकती है. अब मैं सर से पूछूंगी, सर का एक बहुत अच्छा बताया हुआ मुझे पढ़ाया है उन्होंने, तो मैं वापस उनसे कहूँगी रिपीट करने के लिए. एक सर का एक फॉर्मूला है ABCD से, वो बताते हैं कि कौन से वो पेशेंट हैं जिनके अंदर ये उम्मीद जगाई जा सकती है कि आपकी डायबिटीज़ रेमिशन में रहेगी. Sir, what is your ABCD formula, sir?
So, to identify people with type 2 diabetes who can undergo remission, think of 5 people who are likely to do that. Number 1 is A stands for A1C. If your A1C is not very high, normal you know is 5.6, up to 7 you say for a diabetic it's okay. If it is 8, 8.5, you are still not very bad. That means you are at, you have a chance of getting your diabetes under remission. B stands for BMI. So, BMI is your weight, body weight. As madam just said, if you are overweight, your chance of achieving remission is much more than if you are a very thin person. A thin person means you do not have insulin deficiency. Obesity means hyperinsulinism. So, it is a very simple way of knowing whether you have insulin in your body or not. So, obese people, so BMI is higher, your chances is greater. So, C stands for C-peptide. So, C-peptide is the insulin secretory capacity of your body, which is measured during the test. If your C-peptide is good, if you have enough insulin in your body, you are the one who is going to achieve remission. If your pancreas is already burnt out, then there is no way you are going to achieve the remission. D stands for duration of diabetes. The shorter the duration, the greater the chances of achieving remission. It has been worked out that those with 6 years duration are likely to achieve remission. As it goes to 8, 10, 12, 15, 20, chance of remission is very remote. Maybe 1 in 10,000 or 1 in 100,000 may achieve it, but generally you can't. And E, most important, is an enthusiastic person. You can say all this, but the person who has to do it has to follow it. He has to go on that, he or she has to go on that diet, which is very, very, very frugal. It's virtually like a starvation diet. Okay, so you have to follow that, not for 1 day, 2 days, for weeks, months together, and probably for years together. So you have to find such people who are very, very, very motivated. Some people try everything. We call it as, you know, in the good old days, we used to have the soda bottle, you know, and there we used to have a marble inside. So you push that marble and whoosh, it will come out. All the gas will come out. So that is all the enthusiasm. Within 2 minutes, it's gone. So some people are like that. Their enthusiasm is like a soda bottle. So their enthusiasm is for 1 week, 2 weeks. Forget it. No remission for you. If you are one of those persistent types who will go on and on, who will get that 10,000 steps, rain or shine, they are the people who will do it. So find such people, then motivate them, because unless you motivate them, they will also give up. Yes, 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 come on, come on, you can do it, you can do it. You remember in a race when somebody is running and somebody is standing there, say, come on, come on, come on, come on, do it. Then you run, otherwise you will give up, you know. So they need constant motivation, hand holding and so on. But by nature, there must be people who are willing to do that, to put themselves through that, and clearly explain to them, if you do all this, you may achieve remission. For whatever period you are able to get it, that's fine. But that does not mean that you can do whatever you did before you got diabetes. Your strict rules will still continue. Maybe your diet will increase a little bit more, but you are not going to eat all those gulab jamuns and badam halwas that you were eating earlier, and you cannot stop exercising, again put on weight and watch TV for 6 hours and all that. It is not going to happen, because if you do that, again diabetes will come back. It is just waiting to come back. By doing all that, you are removing the, you are opening the cage and allowing the tiger to come out. So the tiger has to be kept in the cage permanently.
So वक्त है एक नई ABCD सीखने का, जैसा सर ने बताया. तो आप ऐसा मानिए कि कोई अगर किसी का वज़न ज़्यादा है और उसको कुछ ही समय हुआ है ये पता लगाए हुए कि उसका A1C बढ़ना सिर्फ शुरू हुआ है, यानी हमारा कट ऑफ अगर हम 6.5 मानते हैं या 9 प्री डायबिटीज़ का रेंज लें तो 5.7 मानते हैं, तो अगर उसका HbA1c 5.7 से जस्ट बढ़ना ही शुरू हुआ है या ज़्यादा से ज़्यादा 7, 7.5 तक पहुंचा है और उसका वज़न ज़्यादा है, तो वो चाहे अगर उसमें लगन है, निष्ठा है, तो वो बिना दवाइयों के, बिना डायबिटीज़ के एक हेल्दी स्वस्थ जीवन बिता सकता है. So this is the new ABCDE of diabetes as per our guest, our honor, Dr. V. Mohan sir. Sir, एक last में I would like to request you to give a message to our people, because probably कहीं कुछ गलत, some wrong message might not go, that exercise and diet is not only for obese and not only for diabetics.
Correct.
It is a primordial prevention actually, and for health. Forget weight, whatever weight, even the lean should be exercising, non-diabetics should be exercising, and right from childhood, like we don't have that culture in India. So, the one message for that.
For that you don't have to go far. Just think about how our ancients were. They were hunter-gatherers. So what does that mean? They were running behind animals, running all the time, and then killing the animal. Those days agriculture was not there. Everybody was non-vegetarian only. You killed an animal, you lived. You could live, and so they were hunter gatherers. So they would always be on the move, always running and so on. And then the eating, they never ate 4 meals a day. When they kill that animal, they would eat that animal for that day or the next day, and then they may not eat for the next 2-3 days. So that is how they lived. They didn't have breakfast, lunch, dinner, tea time in between, you know, with the snacks in between, and that is not the life that they lived. We have adopted that life, and the price we are paying for that is obesity, type 2 diabetes, hypertension, heart disease, and even some forms of cancer. All are coming. So I think she was absolutely right that what Dr. Minal is saying, that if you want to be healthy, forget it, your body BMI may be only 19, you should still exercise, because it is a muscle building and health for your, you also have a heart. Okay, your heart also has to be healthy. Just because your BMI is 19 doesn't mean you don't have a heart. So you have to look after your heart. Thin people can have very high cholesterol and blood pressure. Okay. Thin people, I just told you the SID variety, severe insulin deficient variety, type 2 diabetes is going to be very thin. So, you can have all that. Even if you do not have all that, some form of diet control, eating all the junk foods will not only produce diabetes, obesity and heart disease, it will produce cancers. Many cancers have been linked to that. So, eat healthy, eat lot of fruits and vegetables, particularly vegetables. Fruit you cannot equate with vegetables, because fruit contains carbohydrate. So, fruit, yes, 1 fruit a day, 2 fruit a day. Vegetables, have it 3 times a day. Have enough salads. With every meal, try to have some salad, some green leafy vegetables. It will give you iron, B12, everything that you need. And then you cut down on the carbohydrates. We are all eating too much carbohydrate, 70-75% carbohydrate. Make it half. Just cut it to half. Add more protein. Add vegetable protein in the form of Bengal gram, green gram, black gram, rajma, all that, all the dals. You add that, become very healthy. You get fiber, you get protein. Your carbohydrate comes down. It gives you muscle and makes you strong. Okay, it builds up your immunity. Carbohydrate is a villain, because the more carbohydrates you take, too much of carbohydrate, I am not saying carbohydrate should be 0, you need some carbohydrate for energy, but we are taking too much, it is producing inflammation, it is producing obesity. So, reduce that, make your diet a balanced diet, do not make it 0 of anything. 0 carb diet is very bad diet, keto diet, because you will end up taking 80% fat, which is very, very bad. So, take about 30-40% carbohydrate, 30-40% fat, the rest is protein, include vegetables with every meal, vegetable protein. Of course, you say, oh, then do I have to become like a sannyasi, become a vegetarian, I am a strict non-vegetarian. You can have fish or chicken, that is okay, right, if you have really must have it, but plant protein is any day better than animal protein, there is no doubt about that. And then do not drink and smoke and all these bad habits, which modern man only started all this. You think our hunter gatherer was smoking? He did not do all that, So, they all lived their life because they were very healthy and they were very active. We have become very sedentary. So, today we have to count our 10,000 steps and we have to do all that today, because we are sitting all the time. We are doing an interview now, we are sitting, we should be standing, even now we are sitting. So, that is modern man and modern woman. So, therefore, change your lifestyle, bring in the habits, healthy habits, sleep on time, very important. Get your 6 hours to 8 hours of sleep and sleep on time. Do not sit and watch TV, even this show, do not sit and watch at 2 AM. Okay. See it, if you want to watch this program, watch it early and then you go to bed. I think that regular program, if you are able to keep for yourself, you will be healthy, wealthy and wise. That is why they said early to bed and early to rise makes you healthy, wealthy and wise. We are taught that in school. No? All those proverbs and all still remain, nothing has changed.
So, maybe the last question I can put up.
Going on, I do not know about the time, okay.
Do we need to cut it out or can I ask the last question?
You ask, they will cut it anyway. So,
doesn't matter, doesn't matter. So, there is a last very interesting question, because it just clicked me. How do you see a person in remission versus a well controlled euglycemic on treatment patient? Same BMI, confounding factors done away with. A person in remission versus a person, euglycemic person on treatment?
I think they are both the same, because once the A1C is kept under control, let us say somebody's A1C is below 6.5, but they are on medication, and somebody else is 6.5 but not on medication. As far as the biology is concerned, as far as the hyperglycemia or the euglycemia is concerned, it is the same. It is just that they are taking one particular medicine. That brings us to the question, are those medicines bad? Is it going to produce any side effects? After my 50 years of experience in this field, I know that these medicines have stood the test of time. Whether it is metformin or sulfonylurea or any of the other drugs, including insulin, they have all stood the test of time. My 100-year-old and 90-year-old, I have got 400 people who have crossed 90 years of age. They are all taking tablets, some of them are taking insulin, they are doing well. So, they have lived to tell the tale, and since I have the evidence that they have lived it, none of them had remission. None of them were marathon runners, or none of them were so strict in everything. They were moderation, they had just moderation in everything that they did, and they were able to live their lives. So, we are not telling everyone become saints, do not do this, no more sweet for your life. We are not saying all that. Have your cheat day, once a week you have cheat day, but cheat in moderation also. You cannot that day finish off one whole tin of rasgulla, you cannot finish off because it is my cheat day. So, cheating also should be in moderation. Sleeping also should be in moderation. Too much of sleep is also bad. More than 8 hours is not good. We have shown that in the Pure study. So, I think everything you do in moderation, have common sense, I think you will have a long and healthy life.
Thank you so much, sir. आपका बहुत बहुत आभार. आप जयपुर आए, 77th APICON में आपने हमारे साथ जो वक्त बिताया, द क्वालिटी टाइम, वी आर रियली ग्रेटफुल टू यू फॉर दैट।
Thank you. Namaskar.